If you've recently had a surgery and have to be non-weight bearing for a few weeks, it can feel like you need to put your life on hold. But as an orthopedic physical therapy specialist, I can tell you that staying active is key to recovery. In this video, I'll show you some simple tips to stay active while using a wheelchair. And if you're not using a wheelchair, but you find yourself sitting for the majority of your day, these exercises will be good for you too. Now, when you're inactive after a surgery, that can result in muscle loss, joint or muscle stiffness, or even worse, pressure sores underneath your bottom or blood clots in your legs. But by using these exercises, you can stay active and facilitate your recovery. Now, keep in mind that every surgery is different, and depending on what type of surgery you had, you may have some specific precautions or limitations. So only do the exercises that you feel safe doing, and when in doubt, talk to your surgeon or physical therapist. So the first exercise is just going to be a side-to-side weight shifting. This is particularly important for people who are in a wheelchair because you can develop pressure sores underneath your bottom when you're sitting all day long. So to do this, just lean to one side, put all of your weight over on one side, then lean to the other side, put all of your weight over on the other side, and then repeat. And when you're in a wheelchair all day long, you'll want to periodically shift your weight to one side and shift your weight to the other side to relieve pressure on specific parts of your bottom. Additionally, shifting your pressure more forward on your pelvis and more backwards on your pelvis can help keep your spine from getting stiff or sore when you're using a wheelchair. To see that from a side view, you'll shift forward like that, shift backwards, shift forward. So you're actually arching your back and flattening your back, arching your back and flattening your back. That also moves pressure more to the front of your pelvis and the back of your pelvis, front of your pelvis and back of your pelvis. So that was the weight shifting exercise. Next, we're going to move to the hips. And the first exercise we'll do is just a seated marching. Try to lift your legs up as high as you possibly can while sitting in the chair or on the couch. If you need to, you can move the armrests on the chair out of the way to give you a little bit more space to do this exercise and lift up and down like that. For safety purposes, also make sure that you have the brakes locked if you have balance concerns and feel like you might fall out. So you'll lift up as high as you can and then lift up as high as you can on the other leg. Hold for about 1 to 2 seconds on each leg and repeat that for 10 times each leg. Next, we're going to do an external rotation motion. And oftentimes we exercise in this forward to backward plane, but we forget about the side to side and rotational planes, which is where many people get weak. So to do this, you're going to pretend there's an axis running through your thigh, and you're just trying to rotate your lower leg bone around that. So this is hip external rotation because your thigh is rotating out that way. Even though your leg is going inwards, it's an external rotation at the hip. You'll do 10 times on each leg with that one. And again, hold for about 1 to 2 seconds at the top position and lower back down. Hold 1 to 2 seconds and lower back down. Next, we'll move to the knees. If you're sitting for long periods of time with your knees bent all day, it can become really hard to straighten your legs. And when you finally get out of the chair, of course, you'll have to straighten your knees to come up to a standing position. So it's good to maintain that mobility while you're sitting in the chair, just by straightening as far as you can comfortably, and then coming back down, straightening as far as you can comfortably, and then coming back down. This also helps glide your sciatic nerve back and forth as you're sitting in the chair. And again, you'll repeat that for about 10 repetitions each leg. Next, we'll move down to the ankles. You can do seated heel raises to keep your calves active, just going up and down like this. This is really important because your calves act as a muscle pump to help return blood back to your heart. When you're sitting with your legs hanging down in a dependent position like this, blood can pool down in your legs, and that's a risk factor for developing a DVT or a blood clot in your legs. So by using your calf muscles, just going back and forth like that, the calf muscles squish the veins and help push the blood back up in the direction of your heart. Additionally, doing a ankle pump like that, where your legs are elevated, is another way to help return blood flow, as well as work on the gastrocnemius muscle, the calf muscle that crosses the knee. Now, another exercise that people often don't think about is a posture exercise. Because when you're sitting in a wheelchair for a prolonged period of time, you can get slouched over, particularly if you're leaning down on the armrests like that. So sitting up nice and tall, lifting your chest, bringing the arms up this way, and thinking about rotating your arms backwards helps stretch your chest and shoulder muscles. It also helps strengthen the muscles in your back between the shoulder blades, as well as your spinal extensors that lift you up that way. Lift up and hold this way for a minute, or if you can't hold it for that long, do 2 sets of 30 seconds or 3 sets of 20 seconds, whatever adds up to a minute total. Now, another important thing in facilitating your recovery is trying to do as much of your normal activities as you can. And that's really difficult to do when you can't bear weight on your legs. That's where having an electric wheelchair can come in handy. It can allow you to get outside of your house and experience the sounds, smells, and fresh air of being out in nature, which is good for both your physical and your mental well-being. Additionally, you can accompany family members when they go out on outings, so you don't feel like you're missing out on the important things in life. This lightweight electric wheelchair by Kerdom is perfect for people who need a wheelchair on a temporary basis. It weighs only 33 pounds, so it's easy enough for a family member or friend to fold up and put in their car, even if they have some mobility issues themselves. The battery will last up to 15 miles on a single charge, so you're not limited in the activities that you can do. Additionally, it operates easily using just a joystick, and the chair and battery meet air travel requirements if you should ever need to take it with you on vacation in the future. If you'd like to check out this electric wheelchair by Kerdom, just click the link down below this video.